Alki Construction. That
Yeah, I read that. Did you get my newsletter that came out this morning about that?
I did. I hadn't heard that it went up to the Supreme Court, but that guy
Yep.
lives around the corner from me.
Yeah, well, dude, I'm not sad about the decision.
What happened?
Yeah, it was the guy from Alki Sewer, Alki Construction. Back in 2016, he left to go get lunch and left his guys there, and they weren't fully shored, and it was a collapse. And the guy from, correct me if I'm wrong, the way I've understood the story is it didn't cover him all the way; it crushed him.
Yeah, killed him.
And it killed him. And
this had been a problem before. This wasn't a surprise one-off situation.
Exactly. So anyway, but the guy, I've got a picture because I had to call the cops because they ride these little 50 scooters through the neighborhood.
Yeah.
And they will ride 4 kids and 1 adult, no helmets, riding up and down through the neighborhood. So I finally called the cops, and the cops were like, "Well, they said they all got helmets." And then I sent the sheriff the picture, and funny enough, they stopped riding scooters.
All right, Liz, if you have one slide up, right? Like employer solutions law, you see one slide. Okay, I think we're set to go. Did you want to start recording after a little introduction or something?
I am recording.
Yeah.
Well, we're gonna edit. We'll edit out the beginning. Don't worry.
Yeah, and all the chit chat for sure. Okay.
All right, we're ready.
Okay. Good afternoon, everybody. For those of you here, you've been talking with me. Anyone watching this recorded, my name is Karen Forner. I'm an attorney in Washington State who represents employers on all matters labor and industries, workers' comp, safety, employment law, and the like. And my training today is going to be covering opioids, drugs, and alcohol addiction and use in the workplace. Most of my clients are in construction, transportation, some retail and hospitality, but these are an issue in all those occupations. To give you a roadmap of what we're going to be covering today, we're going to be talking about the opioid problem, a little bit of history and what's going on. 2, we're going to cover labor and industries policies around opioid use and keep that in mind when dealing with your workers' compensation cases. We'll go a little bit more into marijuana and alcohol. And then, the real key is what are some best practices for you as an employer knowing more about these issues. So let's dive into opioids. The director of the Department of Labor and Industries, the medical director, has said that the rampant prescription of opioids is the worst man-made epidemic in modern medical history. And if you don't believe COVID is a man-made epidemic, I think I'd have to agree. This is mostly caused by overprescribing. I mean, if you look back in your history, the older you are, the more you'll recognize the drugs at the bottom of this list. There's morphine, hydrocodone, oxycodone is 1.3 times as powerful as morphine. Then you've got methadone, that is 10 times more powerful than morphine. Then you've got fentanyl, is 100 times more potent and powerful than morphine. And then carfentanil is 10,000 times more powerful than morphine. So they are creating these drugs that are more and more and more powerful that the human bodies were just not meant to process and withstand. It's a problem across the country. Overdose deaths have been going up year by year by year. And most of them are from opioids, including some people are dying from their prescription opioids. Some are from black market opioids. But if you watch the news at all, this shouldn't be a surprise. It's a growing national problem. I do believe it was caused by pharmaceutical companies who were marketing these drugs to physicians and saying, hey, this is the new miracle drug. You should not let your patients be in pain. Why let them suffer? You're not a good doctor if you're letting your patients suffer. And here's all this, now we know, faulty research that they are non-addictive. There's really no harm in them. Let's push these out to people. So especially people in construction who do hurt shoulders, who do hurt backs, who do sprain ankles, would go and get treated. Doctors just unknowingly, or perhaps because they got kickbacks from pharmaceutical companies, who knows? But that's where this real problem started, is from prescribers and through doctors. And then people needing larger and larger doses, the doctor finally cuts them off, they have terrible withdrawals, and then often they go and search for the drugs. Either they switch from pharmaceutical opioids to heroin, or they find it on the black market. You know, this started out because these pharmaceutical companies went and lobbied different legislature to pass laws that says, hey, we can never punish doctors for prescribing opioids or for the amount that they do. So they wanted those doctors to feel really secure and really comfortable in writing those prescriptions. That was repealed in Washington in 2012 when we realized people were dropping over dead from the overuse of opioids, but a lot of the damage had been done. Getting ready for this presentation today, because I hadn't done this one in several months, I went and looked and said, well, what is the impact of COVID and the pandemic been on the use of opioids? So it's gotten a lot worse. So we had the highest ever 12-month period from May of 2019 into the first few months of the pandemic. Drug rehab is limited. You can't shove a bunch of people in close together to be in drug rehab with social distancing and safe COVID protocol. If you look at Alcoholics Anonymous or Narcotics Anonymous meetings, used to be in person, in churches, a very effective tool with people dealing with addiction. Many of those are limited or can only be done virtually. It's really had a negative impact on addiction. In Washington State, we've got a huge uptick. Fentanyl overdose deaths have more than doubled from 2019 and into 2020. There's a huge problem in King County in Washington with fentanyl. It's that extremely, I think fentanyl is 100 times more powerful than morphine. If anyone is using a drug that is not from a pharmacy, they should presume that there may be fentanyl in it. And it can be extremely deadly. You get more than 1 or 2 micrograms more than what a body can handle, and the person can die of an overdose. This isn't just a moral issue. It's not just an issue of trying to do right by people. The opioid epidemic is extremely expensive to businesses, bottom line, and to our economy. There's estimates that it costs $81 billion a year from the impact of opioid abuse in the American economy. You know, in construction, it's a big problem because, like I mentioned before, it's physically demanding work. People have a lot of wear and tear. They're using their bodies to get the job done. And when they get injured, often medical providers are not as cautious maybe as they should be in the frequency and amount of opioids that they prescribe to get the person functional again. What's interesting about the addiction is, you know, people's pain is real, right? It's not psychosomatic. But if you take opioids, it actually amplifies the experience of pain. So you lose your tolerance for the pain. So let's say I'm feeling pain, and on a scale of 1 to 10, it feels like a 4. And I'm like, this is really uncomfortable. I want some opioids. So I get them, and the pain goes down to a 0, and there's this relief from it. Well, when those wear off and I go back to that same pain, it feels more like a 5 or a 6 or a 7 because I got used to and had that feeling of no pain at all. So in a weird way, people's experience of pain gets amplified from the use of opioids. And again, you do develop a tolerance for them. You need to take more and more to control the pain. And then you become addicted to it, where you feel just absolutely sick and terrible if you're not taking the opioids, even if the underlying condition is resolved and gone away. And then the whole addictive cycle feeds itself. So that's kind of a history of kind of the mess and the problem that opioids are in construction and in our country. Let's look at workers' comp claims, because for many people, this will come up if a worker is injured on your job and has a workers' comp case. And knowing how Labor and Industries addresses that can be helpful in managing your claims. So I will give Labor and Industries credit, which I don't always do, but in this instance, they really have gotten ahead of the problem of opioid use on workers' comp claims, because they were literally seeing workers dying on their workers' comp claims from opioid overdoses. So now it's only if you have like surgery and a fairly major event, you can have opioids up to 6 weeks later. And if there's, justification and proof, maybe stretching that out to 12 weeks. But they should only be getting it past 12 weeks if there's proof of clinically meaningful improvement in function. And if you have a workers' comp case and you work with a retro group or you have some third party that helps you, look in the chart notes of the worker who's getting treated and look to see if they're getting prescribed opioids. If you know that they have an addiction problem or have past addiction, let the treating provider know, let the department know, so you don't inadvertently flare up and cause additional addiction problems. To wean them off, it's appropriate. So if you have a workers' comp case where someone has the opioids, you want to work with the department and be advocating that they get weaned off them as soon as possible. Because if you don't, and the person develops an addiction, even if they had it before, then they were clean, now they're taking opioids, you as an employer will have to pay to treat their addiction, send them to rehab, everything that's involved with that. And if they die of an overdose, you may likely pay for a surviving spouse pension, right? That the workers' comp injury is what caused that person to die of the overdose. The argument is, if I'd never gotten hurt, I wouldn't have gotten on the opioids. It's because on the opioids, and yeah, I had some drinks and it was a contributing cause to my death, then you may end up paying a super expensive surviving spouse pension. So keep an eye out on the amount of opioids, ask a lot of questions, and try to limit the amount as much as possible on workers' comp claims. It's a gift to the worker, and it's a gift to the worker's family, because no one grows up saying, I want to be an addict when I grow up, and no one wants to lose a family member to ODing on opioids. All right, we've covered opioids. There's, if anyone has a big question, you can raise your hand or take a few notes, and I'm happy to do some discussion and question and answer at the end of my presentation. Marijuana and alcohol use, okay? Maybe not as big and sexy as opioids, but still can be problematic in the workplace. So while it's legal in Washington, I know many people who do use marijuana, it does affect performance. So if people are smoking right before work or at work, or are heavy users, it can impair thinking, give memory problems, balance and coordination. You can imagine on a construction site how important coordination, focus, and thinking is from a safety perspective, let alone a quality perspective. The ability to have perform complex tasks, just less alert. You as an employer need to be thoughtful about what your rules are about people using marijuana and working in a safety sensitive occupation like construction. What's surprising to me, considering it's Washington State, is our Supreme Court has said employers can ban workers from using marijuana on or off the job. Even though it's legal, there's no job protection. So if you have a law that says we are testing for THC, we test for marijuana use, if you test positive, you can't work at our place of work, Washington law is going to back you up on that. There's no job protection for medically approved users or recreational users. So the law that passed recreational use, again, there's not job protection. My guess is they didn't include that in the law because they thought it might prevent it from getting passed. Other states are offering more job protection, but in Washington State, you're entitled to say, we test for, heroin and cocaine and marijuana, and if you test positive, this is what's going to happen. You'll need to be really clear with your workers though, because many of them think, hey, if it's legal, That means as long as I'm not smoking at work or it's on my lunch break, I can smoke. So you want to make sure your policies are really clear. You want to name marijuana specifically. Even though it may be recreationally and medical legal in Washington, it is prohibited at this place of work. And if you test for it, this is what's going to happen. Just don't have a policy that says we prohibit all illegal drugs. It is still illegal federally, but you just want to be clear with workers so everyone's on the same page about the choices they make and what you're going to do. Good old alcohol. That's been around for a long time. Abusive use of alcohol is still a significant problem in our society. I don't think that's necessarily gone away. The National Institute of Health says about 3 in 10 U.S. adults drinks at unhealthy levels, either binge drinking, alcoholics, to the point where it's causing health problems. So, as an employer, how does alcohol factor into your workforce? There's people drinking like right before they come to work or during working hours or at lunch. So basically they're drunk at work, or they drank very, very heavily the night before and they're hungover when they come to work. Maybe their blood alcohol level is still high, or even if it's dropped, they're still experiencing the hangover effect. They're not alert, they're tired, they're not focused. And if there's an alcoholic in the family, even if your worker is not the alcoholic, the impact of dealing with an alcoholic in the workplace can be disruptive to that person's focus and performance. And then some people aren't alcoholics, they just occasionally binge drink, and that can be a problem as well. It was interesting to me to research from the National Council of Drug Dependence where alcoholism is the biggest problem. And a lot of it is right in construction. So excavation, installation, maintenance and repair, construction, food service, which I think is mostly restaurants and bars, because those are places where alcohol is what people are going there to drink and it's easily accessible. Healthcare, mining and drilling. So of some of the top 6 industries, a lot of those are kind of blue collar construction related occupations. So if there is likely more alcohol use in your workforce, that means you're going to have more absences from that person. They're more at risk to get hurt on the job and have a workplace injury. And I think there was one test that when they looked at emergency room patients coming in who were injured at work, 16% of them had alcohol in their system. So from a risk perspective, risk management, both workers' comp, liability, it's a big risk to have alcohol impacting your workers. Part of what I do is employment law. Most of you have heard of the Americans with Disabilities Act or the Washington Law Against Discrimination, and that you have to accommodate people who have a disability. It could be a learning disability, a mental health disability, a physical disability. Where does addiction fit in as far as disability accommodation? And the courts have really split the baby on this. They've said if you have the disease of addiction, the condition of addiction, that could be considered a disability, that you can't discriminate against somebody, or maybe they need an accommodation. So if you hired someone who's a recovering alcoholic, they're working on your job and they said, look, I'm a recovering addict. I have my AA meetings are on Wednesdays at 6, so I can't ever work late past Wednesdays at 5 o'clock. And that's the accommodation they wanted for scheduling. You would probably be required to make that accommodation unless you could show that's an undue hardship to your business to never have that person work past 5 on a Wednesday. That being said, if someone is in rehab, you're probably also going to need to accommodate them by giving them leave of absence to go to rehab. Let me go back though. However, if someone is drunk or high in the workplace and they test, then that's not protected. So if you're being responsible about your addiction, you're managing it, or you're going to get it managed, in general, you're probably likely to have to accommodate that. If they are irresponsibly using drugs or not responsibly dealing with it, you probably don't. It's a very tricky gray area though. Be sure to check with human resources before you shoot from the hip on how to handle those situations. Okay. So we've talked about opioids, marijuana, and alcohol. You know, why should you care about these? Well, to be profitable and successful, you need a productive, stable workforce. And none of this should be a surprise to any of you, some of the side effects if you've got these problems in your workplace. People are less efficient. They might steal from you to get money to buy drugs. I've had cases where workers become addicted, so they start selling the drugs to other employees at the workplace to make the money to feed their addiction. You can have accidents. It's really, really expensive as an employer to not get in front of these issues. As I mentioned earlier, if you have a family member who's living with someone who is an addict or is an alcoholic, their job performance can suffer because they're trying to manage and deal and react with that situation at home and the train wrecks that might be causing with the other family member. So we've covered the opioid problem, how L&I deals with opioids, marijuana and alcohol. This is the good part of the presentation, which is what can you as an employer do to get in front of these issues? Okay, as far as workers' compensation claims, like I mentioned earlier, monitor your claims. If you see that there's opioids there, flag it and make sure you're having a more proactive and aggressive stance on monitoring that claim. And if it seems inappropriate, call the department, ask for a nurse case manager to get assigned. You can even call the doctor, get in front of it. If they're on opioids for a while, make sure that you're seeing that there's a plan to taper them off. Usually the department is fairly cooperative on this. If you can bring the worker back light duty as soon as possible, that helps them focus on life moving forward. That sets the expectation that you're going to recover from this injury and return back to your normal life. When people sit home alone and all they've got going on is I hurt my back or I hurt my shoulder, there's no other job duties or people to focus on. They can become hyper-focused on their pain or on their injury, and then it can start feeding on itself. So getting people back in the routine and back to work is going to also help avoid long-term opioid treatment on workers' comp claims. Outside of workers' comp, what are some best practices? Drug testing. I'm a big fan of it. I think it's best practice for employers. If you don't drug test, word gets around with drug using employees that this is the place to go get a job because they don't test. And now you're filling your workforce with people with drug and alcohol problems. So it does deter employees from abusing drugs and alcohol. It saves you from hiring on a problem in the first place. If you do testing, if you are part of a collective bargaining agreement with the union, usually there's protocol in those agreements on how you're going to handle somebody who tests positive. I think most people in NUCA are union employers, so that's going to be your guidelines of what you need to do. And you have a choice. Perhaps your collective bargaining agreement prescribes how and when you can test, but it's really up to each employer if they're not bound by a collective bargaining agreement. Do they want to do it post-offer, pre-hire, reasonable suspicion, random, periodic, anytime you return to duty, you name it. It's just very important that it's followed consistently for all employees. If it's only used for African Americans, or it's only used for people over 50, or it's not done in a fair manner, then you're opening yourself up to retaliation and discrimination lawsuits. So whatever you come up with for your company, just make sure you're consistent with it, and it's evenly and fairly applied. Employee assistance programs. These are one of your key benefits to have for your employees to help with mental health, suicide prevention, and substance abuse, opioid, alcohol, marijuana. They're ridiculously inexpensive from when I looked into them in light of what you get. So it's a confidential service that any of your employees can call, make sure they have their number, their family members have it. If they are experiencing a problem, they understand there's something going on, they don't know where to start. They don't know where to turn, but they don't want the employer to find out. They're afraid they're going to get in trouble or lose their job. This is a place where your employees and family members can call to get help with mental health, alcohol and drug addiction, just everything going on in their lives to get them resources. I strongly recommend it. I think it's something like $3 to $5 per employee per month. Maybe that's even lower than it costs, but in light of what you can avoid as far as expensive problems in the workplace, seems like a bargain. There's been studies that have been done for employers who do have drug-free workplaces combined with these employee assistance programs. Morale goes up, turnover goes down, productivity is up, you have a better quality workforce. There's just a lot of return on investment. This is not my specialty area. If you don't have one and are interested in some options, feel free to email or call me, and I'll put you in touch with some people who offer and set up these employee assistance programs. And again, it's not just the drug addiction, all these different areas, better retention, reduced stress, they're really a great value to your workforce. So you can have one, right? It's like if you have an accident prevention program that's sitting on the shelf in the 3-ring binder and nobody looks at it, it's not going to be really helpful. Again, if you get these employee assistance programs and they're just kind of sitting there, that's not really helpful either. So you want to help your employees overcome the stigma of seeking out mental health help or addiction problems. So push it out, put it in your newsletters, put the phone number in with their pay stubs and their paychecks. Have people, when they're having company meetings or Monday morning safety talks, talk about it, share the information, and encourage people to use it. Make sure your management is trained when they suspect something's going on. This is one of the tools that they offer employees to help get in front of their problems. You know, overdoses do happen, right? We're having people die on the job of overdoses. For those of you who may not be aware, if it gets to that point, what's a sign of an overdose? The person's face is really pale and gets clammy. Their body's just going limp. Their fingernails or lips start turning purple or blue. They start vomiting or making gurgling noises. They're non-responsive. They can't speak, or their breathing and heart rate is getting so slow and stops. So that's immediate 911, or if you have Narcan available and know how to administer that, those are some of the signs that you've got an overdose situation. So, you know, the repercussions of this are bad. I don't think you can insulate your workforce from it or your business from it entirely. There are a lot of resources to help you manage it, just like there has been on safety. There's some really great toolbox talks that are out there about opioid deaths in construction. It's informative. There can be some discussion points that are part of your toolbox talks. If you want the links to these, I think they're listed there on that slide, or email me and I'll send them, or you can simply just Google is your friend. I love the internet. Toolbox Talks, opioid deaths in construction, or Toolbox Talk, opioid addiction in construction. There's tons of resources out there. They're free, they're easy. Most of them are really well done. It's just a matter of you prioritizing, putting this on the agenda of what your company talks about, and letting your workers know that you care and that there's resources and you don't want this to be a problem and have someone's life ruined. So again, these are just some examples of different organizations, different type of toolbox talks dealing with depression, mental health, substance abuse. Those issues are interrelated, right? I do training on mental health and suicide awareness and prevention, specifically in construction, because it's about 6 times higher in construction than our general population for a number of reasons. So if you're getting in front of these issues, mental health, suicide, addiction, the best practices to help people get help, show you care, are really similar across all those issues. So more, I don't have all the studies. I'm not going to bore you with all the research, but it's been shown that if you invest in the health of your employees, their mental health, helping getting them help with addiction, these other kind of issues, you are going to have a more positive and productive and profitable workplace. And you can feel great about yourself because it also saves lives, because shame or silence doesn't solve anything. And there are tons of resources out there on this issue. There's the U.S. Department of Labor has a drug-free workplace advisor that can help you set up testing programs and policies. Washington State Department of Labor and Industries has topics on it. The National Institute of Health, Institute of Drug Abuse, tons of resources. These Toolbox Talks I told you about. All it is you saying, I'm worried about this being an issue in my workplace. We're going to spend a little bit of time addressing this and seeing what we can push out information to our employees and resources to our employees. And I strongly encourage you to use these EAP programs, because then you don't have to worry about your HR department being a counselor. You don't have to worry, am I giving the wrong advice? I don't know where they should go for drug rehab. You can say, hey, here, call this number. They've got people who are trained to help assess what the problem is, know what tools and resources. Do they need to go to rehab? Do they maybe just need to go to a doctor, right? You let someone else make those hard calls on what the people really need. But most importantly, they're getting the information and resources that they really need. So that in a nutshell is the information on the opioid epidemic and marijuana and alcohol and some best practices for employers to get in front of that. And at this time, I would be happy for any comments, concerns, or questions for those of you who are attending in person.
Does anyone have any questions? That was super informative.
Hey guys, this is Anthony Burby with Johansson Construction. I was just curious what your guys' take was with the CBD oil, like the rubs and stuff. Seems like I had an employee early on that was using some of this oil or lotion that had CBD in it to cure some of his aches and pains. And he ended up coming up positive for a random drug test. So, and he was claiming that he doesn't really do anything but the CBD oil. So I was just curious what your guys' take was on something like that.
I'm sorry, I'm not like proficient in the use of that. Do CBD oils contain THC? I thought they did not.
They do not.
So
Not,
I would say if someone's testing positive for THC while using CBD, they're probably also using marijuana in edibles or smoking it or other formats as well. Because testing for THC is testing for THC.
It's the Barry Bonds defense.
Yeah. Just something that came up that I wanted to kind of get out there.
Yeah.
I got a question also. You in your slides you said we can test pre-hire. We were under the assumption that for some reason the last couple of years that we can't test until after we've given them an offer letter.
Right. Post offer, pre-hire.
Okay.
Yeah.
Gotcha. So, but what happens if we bring them on board? And because right now we're also doing a test on their overall well-being.
Right. Fit for duty.
Right now that's taking a week to 2 weeks to get the drug test and that lined up. So do we have to wait to hire them, or do we hold on to it, or do we bring them on board and have it?
I wouldn't bring them on board till you've checked out their any green card, ability to work, their drug test, and their fit for duty. I know it's hard to wait. If you're hiring someone, it means you got work to do and you need a body ready to go. I think you've got to weigh that as a risk as an employer.
Got
I personally would recommend people, if it's at all economically feasible, to wait, and then also see if you can find another testing facility that can get faster turnaround.
Yeah.
Because the physical shouldn't take that long. If someone's getting a fit for duty physical, it doesn't take a week or two to get that report back, does it?
No, that comes back right away, and no, it's not about the return on it. It's about just getting scheduled in to have, because you have to have them at the same time, kind of thing. So no, we usually get the results pretty fast. It's just it's just getting scheduled in to do it, because they want to do them both at the same time, and the fit for duty is the one that delays it, is what it comes to.
Well, I just ask around, ask in the association, does anyone have a facility that has quicker access to appointments for fit for duty? Then just try to shop for some place that's more available. My guess is under COVID, with physical distancing and a lot of limitations, that might be backing things up a bit. That's just a guess.
Yeah. Gotcha.
You guys, this is Don Gonzalez. I saw some marijuana stuff that was meant to be like outside pain or helping with sleep, and it was 19 components. Is it CBD? And 1 component THC. So they're selling that and marketing that kind of stuff, I believe, as CBD stuff. But I questioned, how could you be taking this stuff and not have some THC with it?
Well, again, I think where you get big conflict and lawsuits is where people have different expectations. So if this CBD thing is coming up and you have a drug policy, you want to come work for our company, this is what we test for, right? And we test for marijuana and this specific drug. So if you use any oil, lotion, edible, vape, you name it, that puts THC in your system and we test for it, you're going to lose your job, or this is a repercussion. So if you want some ointment or oils or whatever, it's on you to make sure whatever ingredients on there don't meet our list of prohibited substances. And that's your responsibility. All right.
That's good feedback. I think it is important to set those upright expectations.
Yeah.
And make it very clear. Because, then there's no wiggle room, right?
Right. And I can see the confusion, right? Like, there's people on their back patio smoking weed on the weekends, right? Like people in all different occupations. The stores are everywhere, right? It's almost like, well, there's the liquor store, there's the weed store. I get drunk on Saturday night, but still go to work Monday morning. Why can't I smoke up on Saturday night and go to work Monday morning? Well, because
wait a second. I drive down the road on Monday morning and Tuesday morning, and I'll smell it as I'm driving to go to work at 6:30 in the morning. So. Yeah.
I know there's plenty of people who are smoking up before they go to work. But again, construction is high danger, high risk. Of course, you're going to test more. Do you think that accounting offices are doing random drug tests or even pre-hire, post-offer? I mean, there's a lot of occupations. Retail, shoot, you're not going to have any fast food workers if you test, right? Like it just depends on how risky your occupation is. Can you actually get a workforce if you test, right?
Right.
Yeah.
We're not union. We're not signatory to a union, but we tell everybody coming in, and even our excavation division is absolutely not union. But we tell everybody coming in that, we have the potential to go on to jobs that are federally funded.
Right.
And we use that as a kind of a leverage, I guess. I don't know if that's a bad thing, but we say we have the potential going on federally funded jobs that may test, like a sound transit job tests.
Yeah.
And so anyway, so that's what we utilize, or we kind of leverage off of that to say we test for everything, just so that we don't have that problem, or we still have the problem, but we not to have.
So when you say we test for everything, that's the clear communication, like all illegal drugs, including but not limited to, heroin, non-prescription opioids, and marijuana, THC, while recreationally and medical, perhaps legal in Washington, still illegal federally and that is also a prohibited substance, kind of paying special attention to it because it's a little bit of a hybrid.
And I do exactly that. Is when I hire somebody, I can't speak to every one of my managers, but when I hire somebody, that's exactly what I say. I understand it's legal in the state of Washington, but we test for it because you're going to be going on jobs that are potentially
Right. And it is an impairing substance. I mean, let's be clear. And we don't have a good test for impairment, right? For alcohol, you can test for impairment level with a breathalyzer, a blood test, your 0.02, your 0.08, or whatever the case may be. We don't know how high impaired people are, right? We just know if you've had it. If they ever come up with some kind of test to evaluate, are you impaired from the level of THC or not, we might have a different conversation. Right? Like right now you test, it's like, well, you went to Jamaica 2 weeks ago, right? And you have THC in your system because it lasts a long time. It hangs out in your fatty cells, right? That person's probably not impaired, but they did go on vacation 2 weeks ago. Then again, they could have been smoking up 3 hours before they came to work, have THC in their system and be impaired at work. Because we don't have a good mechanism for determining impairment from THC, that's why it's just kind of blanket. If you've got it, you're out. Technology, we might be having a different conversation in 5 years. Whoever invents that ability will make millions of dollars if they can develop that technology. First of all, the police want it, right? They pull someone over, they're not drunk, but they seem like they're an impaired driver. If they could have a roadside way to test levels of THC and impairment from it, unlimited market for that.
Oh, yeah,
But
totally.
we don't have that technology yet. But there's lots of smart people out there who like to invent stuff. So I expect that day will come.
And it will probably be from a weed smoker.
Right. Who wants to be able to go to work and keep their good job and still smoke up on the weekends? Exactly right. All right. Any other questions, comments, concerns, discussion points?
No.
Thank you again, Karen, for doing this. That was very informative, and we'll definitely be sending this out to everyone that registered for the class. If you are a NUCA member, you do get these for free regardless, and we'll send out, these are usually password protected. And if you have any follow-up questions for Karen, we'll send out her contact information as well. We will see you guys next month for legislative month. We will do our usual court cases that affect your business that we do every single year. That will be happening. We'll do another legislative night with actual legislators. So we'll get them on the horn so you can address them face to face. And then there are potentially a couple other things we're doing around legislation next month. So just take a look out for that.
Thank you so much for having me. Appreciate it.
Thanks,
Thanks,
Karen.
Karen.
All right. Bye, everybody.
Bye-bye.